The faces of diabetes are everywhere. 3.2 million African Americans have diabetes, and many do not know it. There is no cure for diabetes, but diabetes can be controlled through proper diet, exercise, and medication. Dr. Adrian James is a primary care health provider for the West Oakland Health Council who sees diabetic patients. Keesha Cravanas is the diabetes nurse educator. Together, they provide answers to questions about diabetes.
Diabetes, simply stated, is having too much sugar in one's bloodstream because the sugar can't get to one's cells where it is used for energy.
I like to think of diabetes as an abnormal sugar metabolism, if you will. What it is when the sugar is too high, it tends to do damage. It damages the blood vessels and it damages the nerves.
Diabetes left untreated can cause debilitating, even fatalities. So we're looking at heart attacks, strokes, kidney disease, nerve damage, which can also cause amputations, you name it.
Now, you have nerves and blood vessels all over your body. Okay? You do. So that means any organ would be fair game for damage by diabetes.
People with diabetes complain of extreme hunger and thirst, also urinating more often, wounds that don't heal or that heal slowly. Women do sometimes complain of yeast infections, and also men complain of erectile dysfunction.
When I say damaged by diabetes, I mean uncontrolled diabetes. Because I can have diabetes and it be well controlled and I'll live a normal life. Okay, it's uncontrolled. That's the key, okay? You don't want uncontrolled diabetes. You want to keep it under control.
Having a family history of diabetes is a risk factor for the development of the disease. And in addition, if one is also overweight or obese past age 40, and also part of ethnic minorities such as African American, Latin, or Asian populations, they should also be tested.
It's really a physician-patient, health educator, nutritionist, sort of a team approach in terms of getting the diabetes under control. What the patient does is exercise, eat right, test the sugars at home. Okay, I get a lot of patients that come in and I ask them, when's the last time you tested your sugar? Oh, a month or two ago. I've been feeling fine. And then I test them, guess what? It's high and they didn't even know it.
The goals for treatment involve optimal blood sugar control. So what this means is fasting blood sugar between 80 to 120, postprandial, which is 1 to 2 hours after meals, blood sugar less than 140, and a hemoglobin A1C level of 6.5% or less. The hemoglobin A1C is a blood test that measures the average blood sugar between 2 to 3 months prior to the time of testing.
Many patients don't keep their appointments. They don't call and reschedule their appointments. If I order tests, they don't do the tests. And then they ask me, well, doc, how am I doing? Well, you haven't done the tests I ordered. I can't tell you how you're doing until you do the testing that we both agreed that you were going to do.
Yes, it is recommended that with a family history of diabetes that one should still be tested. How often that should be determined by their provider, but other risk factors associated with family history, such as being African American, being obese or overweight, and being sedentary or physically inactive, these would all be risk factors as well in determining if one should be tested for diabetes.
Absolutely. I have patients who I have told over and over again, your weight is too high, you need to lose some weight. And I've done this for a year or two, and then that, 50th time that I tell them to lose weight and they actually do it, like, Dr. James, you were right. My pain is a lot better now that I lost that weight. My pressure's come down, my diabetes is better controlled. Thank you, Dr. James. Really put forth an effort and really was able to accomplish a goal. That's a success story.
Every diabetes success story is a story of lifestyle changes. Dr. Adrian James and Nurse Keesha Cravanas are available at the West Oakland Health Council to help you embark upon your very own diabetes success story.
With a